Hi, Deborah here. This is lesson 3 in the Functional Anatomy for Dancers, Move Your Body, level 1. This is my dog, Misha, who likes to be right in the midst of things. So anyway, this lesson is on supination and pronation. This is describing the placement of your foot on the floor. So in your student activity sheet, you'll have this cool little picture. So in the middle, we're looking from the back of the ankle. If the heel cord is straight up and down, you can assume that the weight is evenly divided, remember, between the base of the big toe, little toe, and heel. All right, this is the right foot. When the right foot has more weight on the inner border, on the big toe side, than the little toe side, that's called pronation. And when the foot has more weight on the outside, the little toe side, than the inner side, medial side of the foot, that's called supination. Let's take a look more closely. Here is having an even heel cord, right? Here is having both feet in supination, and this is what pronation looks like, where the inside border has more weight. Let's look at that from the front. Neutral, supination, pronation. When you get into first position, it gets a little trickier sometimes to see because a lot of dancers lift their arches up and they're actually supinating. I'm gripping the floor slightly with my toes and the weight is more on the little toe side. If I'm not using my turnout accurately and I'm rotated out more than what I can do up at the hips, I naturally pronate some, putting more weight on the medial side or the big toe side instead of having it placed evenly between the pad of the big toe, little toe, and heel. A very good exercise for everybody to practice is balancing on one foot. And we're going to encourage you to stand on one foot, get a pinky ball, a tennis ball. This is one of my dog's balls, I'll use it. And just toss the ball up and down, back and forth. Whoa, every now and then you might have to catch your balance. Keep going. And what I want you to become aware of is what gets tired. Is it around your ankle? Is it in your foot? Is it the outside of the hip? Just be aware. And you're going to balance for about 30 seconds. Actually, I have my gymnast learn to balance for up to 3 minutes on one foot on the balance beam. Balance is important. And balance is learned as well. If you don't ask your body to balance, it loses the ability to balance. Oh my goodness, okay, he thinks this is his ball. Misha, sit. Misha, sit. Just stay. So then you want to go to the other side. And you want to just toss the ball back and forth. And now when you're doing the other side, I want you to become aware. Does it feel the same way? Like right away, I feel more stable on this side. Okay, I'm just going to tuck that information away. But what I do notice is I'm noticing the outside of my shin bone slightly. I'm making very sure that I don't drop the ball because as soon as I do, you know who's going to get it, right? All right. So after doing that on both sides, and Misha, here, you can have the ball now. After doing it on both sides, you want to mark down on your activity sheet what you noticed. And if one side was easier than the other side. You want to keep practicing balancing. Balance in neutral on one foot. You can balance in turnout on one foot, and of course do both sides. The point is you want to keep balancing. Your balance will get better because you're asking yourself to balance. The other thing, depending on where you notice the fatigue or the effort coming, just keep working. It might indicate that actually muscles around that area were a little bit weak or a little bit tight. Whichever it is, you don't have to figure it out now. Just keep balancing, and in time, it should start to balance itself out. So enjoy. That was enjoy your balancing. That was lesson 3. On to lesson 4.